Hello and welcome to Healthy Gazali, a brand new show on Live News Goa TV. ह्या शोआंत आमी तुमच्या मुखार हाडटले आपली भलायकी सांबाळपा खातीर वेगळ्यो वेगळ्यो गजाली कशा तरेन तुमी सगळ्यांनी आपल्या हेल्थाची कॅर घेवची, कितें कितें करचें, कितें खावचें, कितें कशा तरेच्यो एक्सरसायजी करच्यो, अशे खुबशे विशय हांव ह्या प्रोग्रामांत आमच्या व्ह्युअरां मुखार हाडटलो. आनी आज आमच्या ह्या नव्या शोचे म्हणजे हेल्दी गजाली प्रोग्रामाच्या पहिल्या भागांत हांव आयला आज कायरोस फिजिओ ह्या रिहॅब सेंटराच्या वास्तूंत हांगा सांतिनेज पणजे हांगा. आनी हो रिहॅब सेंटर कायरोस फिजिओ हाजो संस्थापक आज हांगा आसा आमच्या बरोबर डॉक्टर नेहन आचार्य, a 7-time world champion in yogasana sport, has gone on to understand and take up a profession of being a physiotherapist, a master in physiotherapy. Nhehern Acharya, it feels immensely happy occasion for me to come to you and interact with you at this platform. I would say I have covered your journey as a yogasana sport exponent and at a very top level at that. So then to see you become a wonderful professional and in this physiotherapy field, it is really amazing. Kairos Physio, what does the name stand for?
Yes, so Kairos basically comes from a Greek word which in its simplistic form it means the perfect time or the precision time of doing something. Right? So that is why I use that word, because it means perfect timing for doing physiotherapy, right? And that is how I came about. It took me 2 days to research and that's how I came across this name. So we began our journey in Bangalore in 2023, and it was my first I would say it's my startup, my child, you could say, and it's a new learning experience, quite exciting, right? It's a difficult thing to be an entrepreneur, especially if you don't really have a background in business or entrepreneurship in general. But I was lucky enough to have some good mentors, people to guide me, and Bangalore being Bangalore, you have a lot of people to guide you in business in general. So there were a number of times that I would have patients who would give me, tips and tricks on how to deal with things, and I was lucky like that.
What was the inspiration behind it?
So it was in the back of my head that someday I need to open up a clinic, ideally in Goa. But I feel that dream came quite soon for me, right? I thought, okay, I'll probably experience a couple of years in a hospital setup, and then open up something by myself, because then I will understand how a clinic space works, or how you have to handle things, how equipments are procured, and things management basically. But one thing was, I was fortunate enough to work in Manipal Hospital, Bangalore, and then I also subsequently worked in a small clinic in a small area in Whitefield. And then I was lucky enough to get approached by a very well-known, well-established radiologist in Bangalore who wanted me to partner with them to open a setup. So, well, I wasn't looking for it, but it looked like life was taking me there.
Wow.
Soon. Right, so I opened up a setup in Bangalore first in the year 2023, and that's how we are.
What is the mission and vision of Kairos Physio?
So I would say our vision is, so our tagline basically is live life pain free, right? Our mission would be basically to allow people to live a full life, right? A full life without pain. Our vision is basically to build a community of trust where people would not just think of physiotherapy as rehabilitation, but also as prehab, where you are doing certain things for preventing diseases from arising, right? That is currently my space of expertise, where I deal with a lot of people from the age 30 to say 50, uh, even beyond that, but I would say 30 to 50 on average, where we teach exercise, or we do training, or we do yoga as a combination, so that they do not have lifestyle related diseases that arise, and that is our vision.
What are those typical impediments that can come through due to wrong lifestyles that you correct with
Okay.
them?
So one of the biggest, what do you say, hurdles that people of that category would face is lack of movement, right? Because they are primarily sitting at either their desk, and when they go home, they're relaxing in front of their TV. So I would say their first hurdle is movement, right? Movement of all the joints. We have so many joints, right? We are not a single unit, or we would be a tree. So the next hurdle would be what they accept as movement that is enough, right? So what I believe currently is happening is a lot of people seem to understand or have the notion that something like walking is considered as exercise. It is an exercise, but you need to understand that is the basic minimal that you can do for yourself, right? So whenever I have a question, for one of my questions to my clients or my patients is that what kind of physical activity you involve yourself in. So most of the times they would be lost, and if at all, they would say, I go for walking every day, and they walk for maybe 10,000 steps, and so on and so forth. And if you look further into it, it seems to be like an idea that is within the community and somewhat reinforced by some physicians, that walking is enough as an exercise. Although I believe that the physicians are probably telling from the point of view that it is something better than nothing, and at least it may be some form of activity that could help your control of sugar, right? But because they do not understand the whole situation and the reasoning behind what the doctor is saying or what the idea is, they stick to the point that walking could be a sufficient exercise. So I would say for this populace, this is my biggest hurdle in general, lack of movement and their understanding of how much of movement is essentially good for them. So I would say almost the first half of my sitting in the beginning, and even consecutive sessions when I am discussing with them, goes a lot with advising on how more exercises, more movement is going to be beneficial, or making them understand how the body changes and adapts based on their lifestyle and how their diet is. We go on and discuss everything about life in general.
Yeah, Tushar, you have mentioned that generally people have this belief that walking might be enough for them to burn their calories and be healthy
Yes.
on the face of it. Even there is a kind of thought process that playing certain sport is enough, like you run or you do swimming or maybe play some sort of a sport, a shuttle racket sport or maybe, and that would be enough. What do you think about even people who indulge in all these sports and still they could have some hurdles in their movement?
Movements.
How is
So it's a very subjective answer that I will have. It depends on the context. Now, if someone tells me that they play a certain sport every day, I would say you're still quite mobile, right? Because it would be demanding on every occasion that you practice. But if it is something like you practice or you play the game every weekend, then the rest of the week is basically less movement. So in those cases, that is ineffective. You cannot consider it as an exercise of daily routine, right? When you say exercise, it has to be exercise that is being done daily. When it comes to sports being the only form of exercise, I would say to some extent it can be true. You can utilize sports as the only form of exercise, but over the years what I have noticed is because of certain repetitive movements and biases of utilization of muscles or certain muscle groups, what would happen is parts of the body would be more stronger than the other, and these create imbalances which later on create further issues. So that is why I recommend ki if you play a sport, regardless of whether you play a sport, you should do some form of strength training, basic strength training. It doesn't have to be very extensive, but some form of basic strength training which would reinforce your body overall, not just to allow you to perform better in the sport, but in general. Aging is a very deteriorative process, right? You're losing bone mass, you're losing muscle mass with every year of life, and it becomes more prevalent after you cross 30s, right? I have a lot of youngsters coming with such kind of problems which should be in their 40s right now, is because their younger years were basically sitting in one spot and probably studying or probably gaming and not moving enough. That aside, aging is basically a deteriorative process, and the only way to combat it is to provide a stimulus to the body that you need to retain a certain amount of muscle or bone strength to function. And if you provide that stimulus like in the form of exercise, the muscle will grow accordingly, right? And if you provided the basic nutrition for building those cells and tissues, it will grow healthy.
Right.
It's as simple as that.
What are the learnings from your own yogasana exposure and the scientific training that academics that you have gone through, understanding strength training, and how have you blended them together that you are now providing expertise in?
Okay. I would say my understanding of understanding and evolution would have happened over 3 stages. Okay, I'll tell you how it worked. So my initial stage of understanding of what is required as yoga or movement was basically flexibility, because that is what I was exposed to as participating in sports, where flexibility and balance seems to be the core component of it. The more flexible you are, the better the pose you can perform, and that was what we would chase because we have no understanding at that age. We just see ki, oh, this looks great, we need to try that, right? But over a period of time, I started developing certain injuries and certain weaknesses in my body, which at the time were not very obvious. But when I started learning physiotherapy, understanding mechanics better, biomechanics better, that was when I could connect the dots ki, oh, this could be the reason why I feel weak, right? So there was a phase, I would say my second phase, where I started questioning ki whether I need to do this, right? Maybe it's not right for my body, at least. That's what academics helps you to do. It makes you question things. So there was in fact a short 2 to 3 months, no, maybe 3 to 4 months, where I absolutely stopped practicing yoga and focused entirely on strength training. I mean, there's another motive behind that also. At the time, I was very skinny, and I guess I was also trying to build on some amount of muscle. But then one funny incident happened, right? So we used to do strength training together with other doctors, and at one point of time there was a discussion about not being able to scratch the back with your hand. And I was part of that conversation. So everyone was testing themselves. Can you scratch your back? Are you too built to do that? So I had not gained that much muscle, but I was barely able to do just this much. Just because I was entirely focused on strength training and there was no flexibility at that point of time. And this was over a span of maybe 3 months. Okay. So that made me revisit and rethink my decisions on what is good for me. And that brought me to my third stage, and that is where I am at right now, where I like to keep a balance of strength and mobility, where it's not just me trying to stretch a muscle to its maximum potential, it's me trying to move the joint in its maximum potential. That is something that will keep me healthy for a longer time. So that is how I would say it has evolved into my personal practice, and that is how I train people as well, where I will take their goals in mind and see whether they really need to be able to touch their toes or they want to be able to sit and squat, right? What is their actual goal there? Because there are not a lot of instances where you would have to have your legs straight and go all the way down. Okay, this is in terms of practicality.
Yes.
It is not bad to be able to do that. It is obviously a cool thing to do as well. But at one point of time, you need to practically also question whether how much of flexibility versus how much of stability is what you require on a day-to-day basis. And not everyone needs to be super flexible, and not everyone needs to be super stable. There has to be a balance based on what you do, how your life is, what your lifestyle choices are, or movements are. So that is how we evolve, and that is how I would say I put it into my practice.
What are the various treatments that are available at Kairos Physio?
Kairos Physio, okay. So I handle the orthopedic part, where I see patients with musculoskeletal disorders, muscle tears, certain arthritis, right? This is my forte, right? We also have Dr. Shreyat Donadkar, who is our pediatric specialist and also handles neuro department. So when it comes to neuro, we handle things like stroke, cerebral palsy. Cerebral palsy also comes under pediatrics. There are many neurological disorders which is not my domain, so I will not be able to list all of them out. Then comes our pediatric part, where we primarily deal with kids who have developmental delays and who need assistance with deformities or disabilities, right? Corrective measures that require at that time. So we basically cater from both end-to-end ages,
Right.
from pediatrics all the way to the older population. So we cover almost everything, except probably you can say the ICU, right? There's a specialty for ICU as well, which we don't cover at the moment, at least.
If you've been asked about any questions that are based on myths, like लोक येतात visit करतात कितें कितें तांच्या तकलेन, they may have wrong notions as well, like yoga बद्दल or strength training बद्दल, anything that you want to shed light on.
Okay.
Misunderstandings.
One misunderstanding that I come across every time is that people who seem to be above the age of even 50, they think that now is not the right time for me to do weight training or lift heavy weights. But in fact, at that age, it is the most necessary thing for you, because your bone density is on a decline, your muscles are on a decline, and the only way you can retain and get stronger to do or be independent for that fact is lifting heavy. So there is no age to start. I have trained people at the age of 80 as well, the oldest being 82, who have lifted. If you can see, there's a barbell behind us, right? And we have a machine here as well. They have lifted all these to strengthen themselves as well, and then they carry on and try to practice this at home as well in their own setups. But yeah, that is the most biggest myth I have seen in general, that I am too old for this, and maybe I should do something very basic, and that leads to another myth. So a lot of times people think ki I'm too old for this, so maybe I should do something lighter, which would either be yoga or walking. Walking, like I said, is not efficient enough to be called as an exercise. Whereas when it comes to yoga, the problem that arises is the practice that they would indulge themselves in is again not effective, and if they indulge themselves in a little more strenuous kind of activities, yoga challenges their body so much that it leads to some sort of injuries sometimes, unfortunately, not always, but sometimes, and then that sets them back to doing nothing again. right? So I've had a couple of cases in the past as well who have done yoga as a form of activity, and they have injured their back. So primarily I have seen back injuries and wrist injuries when it comes to yoga. And because of that one injury, they stopped doing any sort of physical activity. So my advice in general to such kind of populace is ki if you want to get into certain physical activity, you pick something that you like and you find is easier to do on a day-to-day basis. Obviously in the beginning you might find it hard because it's new to the body. You might have certain aches and soreness which you have not experienced for a while, and sometimes it can be quite scary when you have aches and pains, whether it is the normal kind or if it is injurious, right? So obviously for that you have your trainers, you will have your physicians, you will have us as physios to guide you whether it's a good or a bad kind of pain. And when you start liking something, stick to it, carry it for life.
Dr. Nhehern Acharya, thank you very much for agreeing to be part of this show.
It was
And,
lovely to have you here as well.